Hi, Ryan and Alex. Welcome. Welcome to the ProTech Community Partner Showcase. Very happy to have you. So I know you guys are from ACAST. Can you tell us a bit about ACAST and what your role is there?
Yeah, so I can start with ACAST is a nonprofit community organization providing sexual health services to the East and Southeast Asian community in Toronto. My role there is a manager of education and outreach, but I primarily focus on programming for Asian LGBTQ. That's it. Yeah.
All right, so my name is Alex. I am a support program coordinator at ACAS. So me and my team providing confidential support and practical support to people living with HIV who are East and Southeast Asian.
Mm-hmm. So what kind of specific services that each of your program provides? And then like what kind of, I guess within the education and prevention program, what are some of your specific target populations?
So the programs that I oversee, one is specifically for youth, East and Southeast Asian LGBTQ youth under 30, that focuses on building leadership skills and resiliency among this group. And then I also run the men's program, which focuses on gay, bisexual, queer, cisgender, and transgender men. And usually that focuses on HIV prevention and sexual health education.
And the support program?
Right, yeah, sure. So for support program, me and my team, we provide different support to our clients. So for example, we have emotional support, such as case management, peer counseling, buddy programs. And we also do social support, such as social gathering, peer support groups, and some practical support such as complementary therapies like massage, acupuncture, and also we do community development and health promotion workshops online or in person about HIV topics or any health related information too.
Mm-hmm. So how have you seen the needs of our communities being affected or changed since the pandemic? Like what are the impact that you've seen from your frontline experience?
So what I can talk about a bit is how even before the pandemic, there's always been a need for more safe spaces and services for Asian queer and trans folks. But since the pandemic, this community has been driven to more isolation. I think with the connection to community that reflects your identities is really important and can help that person feel more validated and accepted for who they are. But then when someone who's LGBTQ isn't out of the closet, maybe living in the suburbs with no community or representation of those identities, and living with family who they might not be out to, or people that might not be as supportive, this can be very isolating, and it can be very hard to not have that space to openly express your own LGBT identity, to be yourself and accepted. And then we see this ties into just the increased stressors of the pandemic and this isolation.
Yeah, and for support clients, actually, we do see a lot of isolation, like isolation and some mental health issues too. But apart from that, because of their unique, health conditions, so some clients are actually more concerned about, contracting COVID-19 because they're more immunocompromised too. So there's this layer of fear that they might have to take extra step to protect themselves.
So, in view of these needs and things, like how have ACAS adapted its programs? Like what strategies have you used to try to adapt to the pandemic? I know most agencies have switched to online programming and services, right? But have you found that to be effective? to the needs, or what kind of challenges you run into, and what kind of innovations have you made to deal with those?
I can speak a little bit for the support program first.
Mm-hmm.
So there are some, rising needs in the community right now. So I just touch on the fear or the concern, health concern, and then also, financial support, because a lot of people lost their job because of the pandemic, and also mental health and, some emotional support too. So since the pandemic, we shift most of our activities and events to online platform. So we try to do regular check-in and try to do regular gatherings. So to keep the community together, to give them some social support too. But there's some difficulties too, because not everybody is, not everybody is good at the internet. Some people might have limited, even phone services or internet services. So it's not a universal platform to reach out to everybody, or it's not perfect for everybody too. So we have to find other ways to engage people who might not be able to do online services that much. So we might have to call them once in a while, text them, and do lunch delivery, just to really like engage them during the pandemic.
Mm-hmm. And then from the education department, or
Yeah, so
how do you do outreach?
very similarly, yeah, everything has moved online, all our workshops and events. I know we would be missing a group of people who aren't as tech savvy, right? Who aren't as familiar with the internet and technology. And as well, we know that because people are at home, if they're not out, they might not have a safe space or privacy to be able to talk online to other people about coming out or about being LGBTQ very freely, right? So that's also a concern. That's a group of people that we're missing. However, we do see new people coming in, joining our events online, because they don't have to travel downtown to our office. They can access us online wherever they are. So there's also some benefits as well. And we are also launching a drop-in online space where people can just casually come in to a Discord server. It's on something called Discord, and it would just kind of simulate a hangout space for Asian LGBTQ people.
So how often do you run those drop-in spaces?
So this drop-in space is actually going to be open 24/7. Like, there's staff that do not have to be within that space. It's for the community to be able to just hang out. If there's different rooms or channels set up where they can they just work together or study. Like, it's just to simulate that people just need to feel like to be around other Asian LGBTQ people and connect.
That sounds very interesting. So like, is that through a Zoom, or what platform does that?
The platform is called Discord.
Discord.
Yeah.
Okay. And then you can run different rooms like without person managing it, or?
Yeah. So the rooms, we just set up different rooms for different categories or different activities, maybe a games room, a music room, and staff can still moderate it, but they don't have to be there the whole time. They just have to check back once in a while to see if there's any issues, concerns that members might bring up, if there are issues or feeling uncomfortable.
So if somebody goes into the space and there's nobody there, and then they wanted to access staff or trying to reach somebody else, is there a way to do that?
Yes, they can still see like the staff members' accounts or Discord, so they can always just leave a message directly to the staff.
So is there like privacy concerns or anything for people going into those spaces?
There is a screening to get to access Discord. So they just have to review some of our ground rules and confidentiality terms. And then there's like a confirmation that they will.
So that sounds very interesting. I learned something new. That's so how have the response been? Like, are people actually accessing it and able to make use of this really
We
interesting
haven't
idea?
officially launched it yet. We're still setting it up.
Okay.
But we've done, the person who is coordinating that has made previous Discord channels or servers for smaller groups. So they're already familiar, and people have been really interested in those ones and have been wanting one from ACAS in general.
So how costly is it for like setting that up? Is it like you have to pay like a big premium to run the
It's free.
platform? Really?
There might be some like premium features that I'm not aware of, but most of the functions that you need are free.
Wow. So that's probably gonna be quite helpful for a lot of communities, right? So thanks for sharing that.
No problem.
So is there other like needs and challenges that you or your program or ACAS has run into because of the pandemic, like in other areas? Because you mentioned like the furthering of marginalization and the loss of safe spaces and privacies for some people to be able to access the support they need, right? How about the area of anti-Asian racism? How does that manifest in our community? Because we know that because of how COVID started, and there has been an increase in anti-Asian racism across the board, exacerbating the long-standing racism that we've been experiencing. So in terms of the LGBTQ context, do you see any specific impact or changes?
So at least for gay men who use gay dating apps, there has been a history of racism and sexual racism on these apps, from other men messaging, being really just very blatantly racist to Asian men on these apps. And now with COVID, with the pandemic, and that the ties to like people calling it the China virus or Wuhan virus, people have experienced that. I've heard from other community members of them being just discriminated and being called a virus on these apps.
Yeah. How about your clients from the support program?
We do hear from time to time that clients are experiencing different levels of discrimination, anti-Asian racism. So we try to bring everybody together to provide a safe space for everybody to talk about the experience. So we had 2 workshops talking about racism. So people got to share their feelings. We got to, express how we feel or like what the experiences are. So it's hopefully they can get the space to, decompress a little bit too.
So we also know that because of the pandemic, a lot of other services also switched their mode of the service delivery, right? And have you heard of or being aware of any challenges in accessing healthcare for people with HIV and our communities?
Yeah, so a lot of the medical appointments moved to phone. So we do more assistance to client with the phone medical appointments. And also they are not recommended to go to the hospital if it is unnecessary. So these small things changes. Also in terms of medication too. So we usually will ask the pharmacy to mail the medication to our clients, so they don't have to travel a long way to the pharmacy or go to the hospital and pick up their medication. So there's some accommodation to fulfill their needs, or to make them not go out and then risk themselves. So these are something that we have been doing. We have been assisting clients.
Mhm. So now we're into like, like the 9th month of the pandemic, and we're in the middle of the second wave, right? So what kind of tips or, advice would you give to our community members in terms of how we can more effectively maintain our mental health and having a healthy and happy sexual health life? Who wants to go first?
Ryan?
Okay, yeah. So I had to think a little bit about this, but
Mhm.
so just mental health tips, I guess, during this time is self-care. I think it's important to, like, what's helped me was just keeping a routine. If I'm
Mhm.
working, making sure that every day have a little bit of stretching in the morning or activity. I'm at home sitting on my computer a lot, so I need to take breaks to move around, and making sure that I'm eating, having proper boundaries, not because we're working at home. It's so easy to start working a lot later or working a lot longer into the evenings. So I have to be
Mhm.
kind of force myself or be a little more strict on maintaining my work hours as
Mhm.
they would be in an office. Um, I think as well, just being for self-care, being lenient on ourselves too. I think we give ourselves a lot of pressure to have to be productive during this time. But I think we always have to remind ourselves that this is a difficult time, and we should be a little more flexible on ourselves, not to feel the pressure to work and be productive all the time is different during a pandemic, during this time.
Mhm.
We shouldn't keep ourselves the same standards as it was without a pandemic.
Yeah, I totally agree with the self-compassion part too. And also on top of that, one tip I'll give is make really good use of all the online resources, because there are so many online workshops, online, exercise group. There's so many ways you can connect with folks online right now, and most of the resources are free. So definitely make good use of that. Sometimes they have self-care workshops, like so our support programs. From time to time, we will host self-care workshops like self-acupressure, traditional Chinese medicine, and also from different agencies too, like Protech. I know they have a lot of mental health series. So I think if people have access to the internet, definitely they can all access to these free community resources. And it will be really helpful to get the social connection as well as some useful tips for their health too.
Mhm. So, in HIV prevention, we talk about like different acts and, relative safety. Is there some public health or community health directives about like the different level of risk and activities that in relation to different sexual activities that has come out?
Mhm. So there are resources and guidelines out there that help reduce the risk of COVID transmission. And so they talk about like examples of different positions or different sexual activities you can do to reduce that risk. So if we're looking at risk as a gradient from like low risk to high risk, of course, and ways to satisfy those sexual needs that you have. So of course, there wouldn't be any risk at all if you're at home and if you need to satisfy yourself, you can do it online, right? A lot of masturbation. Or you can use online cams, right? Webcams with partner virtually
Mhm.
to satisfy that
Cyber, yeah.
as well, recording videos with each other. And then if you go along that risk further, so if you need to meet someone, if you feel like you need something in person, right? Then after asking screening questions, checking with how many people are in their bubble, or if they've been working from home, or do they work in a busy environment? After asking those kind of screening questions, then what can you do in person? So
Mhm.
least risk, again, you can do is maybe masturbating, jacking off in front of each other, but still 6 feet apart with your masks on. That's like the lowest risk in person I can do. Or with glory holes, having a physical barrier between yourselves. And if that's not possible, then you can still move along that gradient with oral sex only. So try and avoid anything face to face, but you're still having that sexual contact orally, below, but like a blowjob. And then again, if you need to do more than that, actual penetration, again, there are certain positions you can use where you're facing away from each other, where your mouths don't have to be in front of each other, and you can keep your mask on as well too. And then of course you can always wash your hands before and after as well.
Yeah, so it's a challenging time for sure. I guess we need to all, make personal decisions and, learn all the information we need about how the virus is transmitted and how we can do different things to both balance our needs as well as protect our health. So thank you.
Yeah, actually you can still also take a COVID test before you meet this person as well. I've heard of how people, if they're meeting multiple different people, they spread it out. So they wait 2 weeks to see if there's any symptoms that come up in between each person that they meet. So that might help just reduce and mitigate those risks.
Any other suggestions, Alex, from your experience and perspective?
In terms of sexual health, or
yeah,
I think, definitely practice more harm reduction too. So it looks different to different people in terms of, what resources they have in their life. So I think it's definitely some reflection too, like what resources can we use that works for you. So there's definitely some resources that you can use to minimize the risk. But I think it's very different to everybody too. So take some time to think about that too, I think.
So thank you so much for sharing all your experiences and information. So there is a lot of resources I know as well on the website. So we'll put the website information to our video. Is there any other advice or things you want to share with our audience before we sign off? If we go forward, what would you like to share with our communities?
I think as we still experiencing this, pandemic, I think self-care it's a long way to go. So please take your time, make an effort to explore different self-care practices because the pandemic might last for a while. So it's good to keep yourself healthy, mentally, physically, and emotionally.
Ryan?
One thing I can think of is I would want to reiterate that the value of being among other queer and trans Asian folks. If you can connect to resources and online spaces, I think it is important to, and it's understated how much it feels to be in even online in a Zoom with other queer Asian folks. It can feel very validating and very affirming. It just gives a very nice warm feeling to be among your community again. So I just encourage other Asian LGBTQ folks to access those spaces when you can.
Yeah, we need community, especially in this long, cold winter ahead of us. So thank you so much for creating and sustaining, safe and supportive communities for our people. And we look forward to working and sharing more with you. Thank you.
Thank you.
Thank you.